The best way to deal with constipation is the topic of today's video. So what would I say is the best way to treat constipation? The simplest, most obvious, most accessible way, and that is drinking water. In today's video, I will tell you what kind of water and in what quantity you should drink when treating constipation. I will name the components of water that you should be wary of if you suffer from constipation. And at the end of the video, you will learn what temperature water should be drunk at different types of constipation. Dehydration, that is insufficient water supply, leads to drying of fecal masses and difficult passage of them through the large intestine. It is favorable to drink 1-2 glasses of pure water in the morning on an empty stomach. It is also useful to drink water with lemon or rose hip infusion on an empty stomach. Mineral waters containing sodium sulfate and magnesium sulfate are effective in constipation. They retain water in the intestine, prevent water absorption, irritate the intestinal wall, and increase peristalsis of intestine. Sodium in the form of sodium chloride enters the body with dietary salt. Sodium is also found in monosodium glutamate and other flavor-enhancing additives. Therefore, we get sodium chloride in excess. Excess sodium in the body can lead to dehydration, high blood pressure, impaired brain function, muscle twitching, and even seizures. Please note, if you have health disorders such as kidney failure, cardiovascular diseases such as atherosclerosis or myocardial infarction, it is especially important to limit dietary salt to 2 grams per day. In some diseases, it's necessary to reduce water intake to 500 to 1000 milliliters per day. Sodium sulfate is known as Glauber's salt, and sodium sulfate, like magnesium sulfate, is used as a laxative. There are many types of mineral water high in sodium sulfate and magnesium sulfate. I prefer to choose water individually, depending on the patient's current condition of the health, the goals of treatment, and the country where my patients live. Some mineral waters contain high concentrations of magnesium, but it may be in a poorly absorbed form, or its effects may be offset by the presence of large amounts of calcium salts. Be careful with mineral water containing calcium salts. Such water has an astringent and hardening action. Therefore, some people, when changing their place of residence, begin to complain about the violation of normal intestinal activity. Not only the salt content of water can affect its effect on the body, the temperature of the water also matters in the treatment of constipation. Mineral waters that have a temperature of up to 20 degrees Celsius are considered cold, from 20 to 35 degrees Celsius warm, and from 35 to 55 degrees Celsius as hot. If you have spastic constipation, you should use hot mineral waters. But if you have atonic constipation, like constipation without abdominal pain, decreased tone and peristalsis of the intestine, then you may be helped by the use of cold mineral waters. I listed the differences between spastic constipation and atonic constipation in the video Constipation, the main causes and types of constipation. If you liked today's video, please share it with your friends. I wish you health, love, and light. Your Dr. Zarifa Romanova.